About 6 months ago I had my first heart valve replacement, and I was recovering quite happily from that till about 2 months after that, and I started to feel a little bit tired and then suffered a mini stroke. After the mini stroke I was in hospital for about 3 or 4 days. I came home and unfortunately I continued to feel worse day by day. The symptoms got so bad one morning that my wife rang the stroke unit at the local hospital, and they advised me to go into A&E. I went back into hospital, into the cardiology unit, and they started to treat me with antibiotics for the infection. The infection I had in the bloodstream and in the heart was just so aggressive that the heart valve had to be replaced.
John had heart valve surgery, and I was contacted the second day after his operation. It transpired that this was his second heart valve operation in the course of several months, and he needed a repeat surgery because of a very rare circumstance where he had an infected heart valve, possibly due to a skin graze or cuts that had occurred in the weeks before.
During the operation, the work they had to do on the heart meant that I had to have a pacemaker fitted. So when I came round, I had a temporary one for about a week and a half, and then Dr Jones fitted the current pacemaker.
The real difficulty with John was deciding when the right time was to implant the permanent pacemaker in terms of balancing the risk of infection. And he made an excellent recovery considering we had to do that fairly early on.
And the first couple of weeks I was feeling quite ill, really. I was quite still quite tired, and was sleeping a lot and really not doing very much. But the last couple of weeks I've been able to get out and about more. I feel pretty normal. I mean, I'm not running around, but I'm walking normally, I'm breathing normally. I'm here for the next 6 weeks from the operation, having quite strong antibiotics for the encarditis infection. And I'm quite looking forward to getting out after that, playing a bit of golf, getting back to normal home life.
John may require further heart rhythm treatment even after a pacemaker has been implanted, and luckily we can monitor that very closely via our pacemaker clinic, and we will be able to see him for follow-up to see what sort of medical or interventional treatments he might benefit from. Harefield is one of the most pioneering centres in the country in terms of taking on new technologies and applying that to our patients in a safe and timely manner.
Wherever you are, you've got really experienced nurses looking after you, and that's one of the real comfort factors of being here, I think, that you know you've got people looking after you who really understand what the issues are.